and welcome back to another episode of Black Law and Legal Lies, where we specialize in telling the truth in spite of all the lies that my cohort Dan tries to tell. I am just Dan, one of your hosts. You can follow me on Twitter at I Tell Legal Lies. You can follow the show across all social media platforms at Black Law Podcast. You can follow Afro Becky home if you can find her. Please don't follow Dan anywhere because he's going straight to hell. And if you want to go there, then do follow him. Next.
All right, you got this, huh? You got this.
Oh, okay. Well, I am another one of your hosts, Afro Becky.
Becky.
And I would
Wake up.
urge you to tell or to take Anne's advice about following me.
Now, let me tell y'all something here. I'm going to dispute the fact that you all should not follow me because I am the lifeblood. I am the lifeblood of this whole organization.
Number one, I didn't say that they should take advice from Anne to not follow you. I didn't say that.
What did
I
you
said to take Anne's advice about not following me.
That's not what I heard. So, let me tell y'all. I'm the lifeblood of this shit here. You know what? This organization will fall and crumble into pieces.
Your name not David Ruffin?
No. I'm the Godfather.
Whatever.
I'm the Godfather. Yo, I still ain't made it through fucking The Irishman. And it's getting to the point where the movie's like 4 hours long, right? So I'll get an hour and a half in, and then I'll go like 3-4 days, and then I done forgot.
And where the hell did that come from?
The Godfather. It's like a Godfather type shit.
Like where is this coming
Ladies
from?
and gentlemen, my name is Dan, a.k.a. Dan on drugs, and I'm trying to be a little sexy.
Nah, he's never sexy. Just to let y'all know.
Show off the little my gray wife beater with
we don't have time for all this. We gotta get deep into this show, man.
My name. Come on, man.
My name is
Dan.
Slim Shady.
Dan on drugs. You can keep up with me on social media at Dan on drugs. I am Dan on drugs. I'm sorry. See, what happens is when I'm interrupted.
No, when he's on drugs.
When I'm interrupted.
By the drugs.
My train of thought automatically gets derailed, and it takes me a second to regather. So you can keep up with me on Twitter and on IG at I am Dan on drugs. Keep up with the show. All social media platforms at Black Law Podcast. Don't forget our merch. Ladies and gentlemen, we have lovely stocking stuffers, although you won't get them. This
by
is after
Christmas.
And it's after Christmas now. So, but you can still stuff some stockings and shit. You know what I'm saying? For Kwanzaa. Ain't Kwanzaa like after Christmas? Kwanzaa.
It is.
Great
Boxing
Kwanzaa.
Day.
Yeah. So
if you're English.
Like I said,
like British.
I just felt.
I thought that was Canadian.
Is it?
I
yes,
thought it's
Boxing Day is Canadian.
It's English too. It's British
I don't know.
as well. Man, look it up.
Yeah.
It is.
So, like I said, I'm just showing off the white beater with the chicken stains on it today because I feel sexy.
Chicken.
I feel sexy,
Stain.
yo. Ladies and gentlemen, prior to getting into our main topic at hand, I wanted to bring Afro Becky in on two things. Becky, thing number one.
And thing two.
Would you ever donate an organ to somebody, whether it be family, loved one, friend, relative, or a complete stranger?
I'm not going to say no, but
I'm not going to say yes.
I would consider it.
Wait, Becky said, I'm not going to say no, but I'm not really going to say yes. I would take it under advisement.
No, not advisement. Under consideration.
Does it matter who the person is?
Like if it was your mom.
I would strongly consider it.
Wow. Just wow.
Does it matter which organ it is?
Well, eyes are organs, so I'm not giving her my eye.
Wow. Do y'all realize
Damn
that
that
the
weed.
clock doesn't have a battery in it?
No,
It
it has
does.
one, but it's just stuck.
Yeah. The
So
hands are stuck.
hands are stuck.
That's that bargain basement Kirkland watch.
Nah, we was moving a mattress down the stairs one time, and it was hanging above at the old
And y'all
condo,
knocked it
and
off.
it fell. It used to have glass on it too.
Mhm.
Wow.
So, Ann, would you ever donate an organ to either loved one, friend, family,
Absolutely, I would.
or a stranger?
I am an official donor on my driver's license. I do believe in organ donation.
No, I mean while you're still living, not
Yes,
after you die.
I would like donate a kidney. I would also donate a piece of liver because you can do that, live donation. I would do that. I was more than willing. As an aside, my grandmother died from multiple myeloma, which, if you don't know what that is, it's it's a bloodborne cancer, and in order to save her, she would have had to have a bone marrow transplant.
That shit hurt.
And
from what
I was
hear.
about to say, for any of you who know about bone marrow transplantation, they can't sedate you. So you have to, and not only was I willing, all of my cousins were willing. If we would have been a viable match, we were all willing. I would have gone down to the dirt for this woman. But
So now, I find this funny. Before I answer, that your lineage does not share the same blood type. It can actually differ from sibling to sibling.
Right. Well, not that blood type, but you have to be compatible. There are so many markers that they test you for so that you are as close a match to them as possible. Some times, some cancers, like for instance, leukemia, you can actually give birth to a child that could save your child with leukemia. And people actually do that.
Wait, say that again?
The cord blood.
They have babies so that they can save their child with leukemia.
Explain that to me like I'm 5.
So you have a child who's, let's say, 5 years old, and they have leukemia.
Okay.
You purposefully get pregnant to have another child so you can get access to cord blood that is used, I think it's with stem cells
It's the
or whatever.
stem cells,
that they can formulate a cure for your 5-year-old child.
Because stem cells.
Can that work for an adult?
I don't know. I've only ever heard it done with children, and in leukemia situations, I've never heard it done to combat other diseases. It's basically because a stem cell can be anything.
Yeah, it can regenerate.
Right. So they literally, like I said, have children who save this other child.
I'm torn. I'm gonna tell a story. Much like your situation, I had an uncle who had a very rare kidney cancer. Both kidneys. He was on dialysis for many years, and I was unaware that even at some point, dialysis does not keep up with.
You can't.
So he needed a kidney. So a lot of people in the family, when it got tested to see if they were matches, none of them were matches. I had an aunt come to me and say, "Have you been tested?" I said, "No, I haven't." She says, "Do you plan on it?" I said, "No, I don't." I was 18 or 19 at the time, and I'm thinking my uncle's old, I love him to death.
Right. I'm 18, and what if I need my kidney?
Right. So turns out that I started having a little bit of kidney issues. Maybe I ain't been back to the doctor because black men we don't cheat and we don't go to the doctor.
One of those things, definitely true.
So I'm like, had I given my uncle a kidney, I might not be here, or I might be struggling, even more. So it's like, I know we have, as you would say, redundancy, 2 lungs, 2 kidneys, 2 eyes, but at 18, if you take one of them, I don't know what I'm going to need down the line. So that's why I didn't do it. Now, would I do it? it really depends on who the person is. My mama, yeah, she can have whatever. My pops, I will give him some urine on his grave. But nah, so it depends on who it is and what the organ is. Like bone marrow. Oh no, bro.
Dude, I was in. The problem for us was, though, my grandmother was 83,
Right.
and they were like, her body could not withstand the procedure. So it was like one or two things are going to kill her: this disease or
Or the
trying to cure
procedure.
this disease.
That and
So
they said that about my grandma. With her, she needed a hip replacement, I think. Now I could be making part of this up, but the other part's true. Now I don't know which one's which. But she needed a hip. She needs a hip replacement,
Black
but
law and legal lies.
she is so old that doing a hip replacement
Would
may
kill her.
actually kill her.
Right,
So
because they would have to go under general anesthesia.
and then cut her and do
And
all
even
that.
for a healthy person, anytime you go under general anesthesia, you
That-
may not come out.
Yeah.
And so for somebody that's in their 80s,
Yep. And that is why, ladies and gentlemen, today's legal word of the week is going to be DNR. Do not resuscitate. I signed one of those. I've had
a
multiple.
long time ago. Yeah.
I've had multiple surgeries, and each time that I go in to have a surgery to where I'm being put under general anesthesia, I
He
sign
signs
a
a
DNR.
DNR.
Do not resuscitate, because if I can die while I'm out, while I'm knocked out, that is the best possible
That's how
way
he wants
to go.
to go, because he won't know that he's dead.
Exactly. And general rabbit hole, general anesthesia is the weirdest shit ever. They don't know how it works. Nobody knows how it works.
What do you mean they don't know how it works?
No, literally, scientists do not know exactly
Why it knocks you out?
Yeah, they don't know why. They don't know the mechanisms and what it. They just know that
It works.
Yeah, and it was accidentally much like a lot of shit was accidentally
Found.
discovered. Yeah, but they
Yeah.
cannot tell
Like
you
penicillin.
how
Like,
it works.
yeah.
Yeah. So I'm like, that's the weirdest shit.
Which is why I'm trying not to go under
Mhm.
general anesthesia. It's real.
No.
Not that I have a fear of
You ever
surgery.
been? You ever had a surgery?
I've never had one, and I'm trying not to have one.
Mhm.
That is exactly right.
Well, try your hardest. Try your best.
I am.
Because-
I literally, that the closest that I've ever come to a surgical procedure is a tooth extraction. And I am literally not trying to go. I'm not trying to go the distance.
So that wasn't you that they fucked the tooth extraction up and it grew back?
No, it
Oh.
wasn't me. It wasn't me.
So I've had it done multiple times, and the thing that's weird is I always thought it was the mask, right?
It's the gas.
No.
They inject you.
Yeah, it's
'Cause
oxygen.
that's oxygen.
Yeah,
right.
but I always thought it was a mask. So my first one, I was freaking out. So they put it on my face, and they're like, count backwards from
Mhm.
10. So I said 10.
Bloop.
That was it. And
Yep.
I'm waking up in recovery. The second one, man, I'm a stubborn motherfucker, and I love challenge and competition. I said, I'm going to get to 5. They put the shit on, and I wasn't even scared for, but I said 10, 9. And I was out. And I remember getting to 8, and vaguely. So Becky, you had a procedure done
Mm-hmm.
under anesthesia, right?
Mm-hmm.
So
Yes.
how was that experience?
Well, I remember they said that they were going to start the anesthesia.
Were you scared?
Not at first.
Because you seen me go through it so many times.
Well, I guess I just didn't know what to expect.
Right.
But so they started the anesthesia drip while they were wheeling me back.
Oh, so you
to
were
the
out
operating room.
before you even got to the operating room?
No. I remember going past my doctor, and she's like, "Hello,
Dr. Payne.
Yes, her name is Dr. Payne.
Wow.
But,
I never, ever in my life would have, I'd have walked into that office. They would have said Dr. Payne. I would say, hell nah, and turned around.
I
No.
need Dr. Feelgood up in that bitch.
Right, like, no.
And I'm like, I really can't see you because literally I couldn't see her
You're
because
blind.
well,
She had to take her contacts out.
I couldn't have
Oh.
contacts or
No,
glasses.
of course not.
And my vision is fucked up. So
Right.
I really couldn't make her out. And so she stepped closer and she said, how you feeling? I'm like, I'm good. Are you getting sleepy? Nah, not at all.
Just like, are you high?
Nah.
So then as we're entering the operating room, they kept on asking me, how you feeling? I'm like, good. Well, then they wheeled me right next to the table and they assisted me when transferring me from the gurney to the table. I remember being kind of lifted a little bit.
Mm-hmm.
And I heard them begin to ask me, how you feeling?
Today's topic.
No. I want to ask a question.
Mhm.
Since y'all have done this and I haven't. I've read some things about that anesthesia causing amnesia.
Yes,
Like temporary or
it does.
longer.
My first one was the worst. That's when I had to get a biopsy of my bladder, and I think I told that in a previous episode. But basically, the only way to go to your bladder is through your dick hole. If you're a man,
urethra.
it's called a dick hole.
It's called the urethra.
And like honestly, they keep people awake for that. But I refused. I'm like, I'm not. You are not shoving a tube because it has like a little claw
Yep.
and a light. So how
That's
you
correct.
fit in a claw?
Because it's small.
Men, you know how big your dick
And it
hole is.
stretches.
That shit painful. It does stretch.
It stretches.
So anyway, they put me under, and they're supposed to. An anesthesiologist comes in. They have a specific calculation of
how much to give
for you, right?
Based on your weight.
And all
whatever.
kinds of shit.
Right.
So I think that time they gave me too much because they had a hard time waking me up, and then when they did wake me up,
Jesus.
My first thought on anything is an out. I always need an. I always on an escape. I want to get out. So as you're coming to, they're asking you questions. Do you know where you are? Do you know what time it is? Do you know this? Do you know that? And luckily, there's a clock on the wall, and I'm like, yep, it's 12:00, whatever. I'm here. Okay, well, he's good. So I don't remember much of that day, period, even prior to the anesthesia. And my doctor came over and he explained exactly what they found, which was a hole in my bladder, or like the lining was wearing away to where my urine could have gone into my bloodstream and killed me.
What causes that?
It's called interstitial cystitis.
Uh-huh.
And that's basically, it's ulcers in your bladder. And it's just an ongoing thing that I have to deal with. But he comes over.
Meds for that?
It's like
so can it happen? It can happen again.
Yeah, it flares. It flares randomly, and there's like, I'm at the point now where I don't need to go see a doctor because it's acid basically. So you start taking these acid neutralizers. I got this stuff in the medicine cabinet called Pre-Leaf. And you take it before you eat or drink anything, and it like goes into your stomach. Then when the acid hits your stomach, boom, it neutralizes the acid before it can even make it to your bladder, to your bowels. Pre-Leaf.
Well, wait a minute. There's acid in your stomach.
Neutralizes. It's like neutralizes all acid. So, and then it tells you on the bottle, if you're going to drink a cup of coffee, take this many, or if you're gonna have tomato, because there's like a lot of stuff. Anyway, here nor there. But doctor comes over and he starts talking to me and explaining, and I remember doing this. you look like a blueberry. Because he was wearing blue scrubs. Blue. And he looked at me and was like, pardon me? Nigga, you look like a blueberry.
You called the doctor the N-word.
Did I? So he looked at me like, what's the point? Why am I talking? So he goes out to the waiting room and talks to my mama. And then they wheel you into recovery after that. So my mama came back and she was like, your doctor told me that you called him the N-word. I said, yeah, I called him a blueberry too. So anyway, I don't like, he explained like a lot of shit. I don't remember any of it. So then the other time I had was called Twilight sedation.
Yeah, you're awake and you basically you're just even. You won't panic, but you still are aware.
No.
That's what it's supposed to be.
Well, I had a colonoscopy, right? They won't do general for colonoscopy.
That's correct.
So they gave you what's Twilight. And this is what's weird. This shit freaked me out. You think you're asleep. You think that, like, after procedure's done, you think you went to sleep because it does.
You're supposed to be aware, though. Like, you're supposed to know that you're up.
It induces amnesia. So basically, I was awake for the whole procedure. I don't remember a damn thing. So in my mind, I was sleeping because
you were not aware of what was going on.
Nothing. And that freaked me out because I asked afterwards, I'm like, because of the first thing that I had, I'm like, how long did it take y'all to wake me up? Like, wake you up? We never put you to sleep. Yeah, y'all did. No, we put you under Twilight, whatever. So I was awake, but I have no recollection of anything. And I said, that's some scary shit. But they use whatever that is. They also use that shit as date rape. Date rape shit.
I could believe that as well.
So if you ever have to have surgery for your situation, I can tell you, little Ricky, don't be afraid of the anesthesia. That's your friend.
Man, hell no. See, that's the thing. I don't want it because I've heard
you don't want anesthesia?
Because I've heard freaky stuff about anesthesia, and because there are a lot of people in my family who've actually had anesthesia. They've had procedure that's required general anesthesia, and they've said things about it, about things, the whole amnesia things, about things that to this day they can't remember, things that they used to do that they can't do anymore, and just crazy stuff like that. And I'm like, man, my mind is my life. So what if I go into this general anesthesia, come back, and I'm like, I can't think right.
So I don't know, but my amnesia was more or less that day. Not like unless it's like I forgot what I don't remember. Right. So yeah, I don't know.
It just freaks me out. So I'm hoping this whole thing like gets taken care of without the surgery.
Well, if you do need surgery, I can tell you that the shit is nerve-wracking, but coming from somebody that has been under how many times? I'm thinking more in line with 5. The bladder, the asshole twice.
You had 2 colonoscopies.
No, I had a sigmoidoscope and a colonoscopy.
And your nuts.
Yep, my nuts when they had to cut my nuts open, and there was one was something for my knee.
5, 6.
I don't know.
No, you just got an injection in your knee. That was 4.
There was a 5th one. I know there was a 5th one. Doc, I don't know, but anyway. So what I'm saying is, it's a lot nerve-wracking, more nerve-wracking than like after the fact. You wake up and you're like, "Damn, that wasn't so bad." Right. But they also have you doped up, and that's the shit that got me. Like they make you before they release you, they make you pee, to make sure, I guess, that
everything is functioning
and
correctly.
I'm already having trouble pissing now, but so they do that, and you can go home. So you go home, and you're like, yo, that wasn't so bad. Like when they cut my nuts open, I literally walked. Well, they wheel you out, but I walked into my mama's house, walked upstairs, walked downstairs, watching TV. Didn't take any painkillers. This is before I found pleasure in taking them. So I'm like, I don't need that shit. And then I guess it's like any other injury. Sometimes you hit your hand or something, and it don't hurt until the next day.
Yeah, when it wears off. When the anesthesia actually wears off.
I could not bend my waist. I had to, you remember I used to have to use a cane?
Yep.
This is how I had to get out of bed. I would be laying flat in the bed on my back. And then that's when I started taking the Percocets, and I fell asleep with a mouthful of gummy lifesavers. But I had to get up and pee. So I took the cane. This is when Becky went around to help me out of bed. And I would put the cane on the wall behind the bed.
And push yourself up.
Push myself up forward. And like my groin hurt, my thighs hurt, my stomach hurt, like everything imaginable. So that took like 3 or 4 days before I could start moving around without the pain.
And see, that's something else. I had somebody tell me today that they had laparoscopic surgery on their stomach. And she was like, well, yeah, even though the recovery time is faster than if they actually have to cut you open traditionally,
it still hurts.
It still will hurt because they have to go through your abdominal muscles, and those things have to heal. And you don't realize how much you use. And I'm like, no, I realize, because you use your abdominal muscles to stabilize
everything.
Yep. Right. Like anything you do involves your abdomen. So I'm thinking about that. Yeah, they got to go through they'll put some in my navel, probably have a cut there and there, but literally, I'm not into pain. I'm sorry.
Man, I think if you do have to have any type of, like, hopefully you don't, but if you do, I think that whole week will be such a blur that seriously, that you'll look up a week later and say it was nothing, because you're going to be on painkillers. So you're going to be loopy as fuck.
You'll sleep through most of it.
Yeah, you will sleep a lot. Like when Becky came home, she had to get what was called DNC, I think. And like they was all up in her. And she like came home, she got in the bed, she slept for damn near 20 hours, got up, I had to keep giving her meds. And then I would say, one for you, one for me, because this is painful, me watching you go through this.
What, you stupid.
But after about a week, I mean, would you say after about a week or so, you were just like back to normal?
I thought it was like 2 days.
Yeah, it wasn't long.
Yeah.
It wasn't long. So
we'll see.
It's a blur.
We'll see.
Don't worry. If you're in the hospital, we're gonna be there with you.
Man, whatever.
Just make sure it's not in New Orleans. New Orleans hospital.
You know what?
Because we ain't coming to see you then. But like, for real, if you in the hospital, we'll come through, and your little IV, I'll kind of kink that bitch up a little bit.
Yeah.
And
so
little alarms going off.